Looking into the urinary system, we're going to look into the anatomy as well as the physiology, just like every other system we've done. But as we go through this one and look into a lot of the anatomy, there'll be components that we've kind of touched on before from the blood vessels and other structures. When we get to the physiology, that's going to be pulling us back into the endocrine system, into the blood and the cardiovascular systems, the blood vessels, as well as digestive and respiratory. They're all starting to come together. So to go through this chapter, make sure you try and put the pieces together. How does the urinary system interact with the other systems we've already talked about? So the overview of the urinary system has 4 main structures. You're going to have the kidneys as the 2 main structures there. But the kidneys then are attaching and going down via the ureters. From the ureters, you go into the urinary bladder. Now, be aware it's the urinary bladder. We do have the gallbladder, don't forget. So urinary bladder. And then you go down to the urethra. Now, the urethra itself will vary male versus female, but those are the 4 main components: kidney, ureter, urinary bladder, and then urethra. So what are the main functions of the kidney? We're saying it's getting rid of waste. All right. It's removing toxins. Because when you ingest your food, you breathe in the air, all these things that come into your system, unfortunately, sometimes there's things that are not good for your system. So while the respiratory system and the mucus can help out, some of that gets in through the blood. Digestion, eating and processing, some of that stuff gets in there. So the kidneys are filtering out what should not be in there. It's also filtering out metabolic waste, things that your body just doesn't need anymore. They're byproducts of the different chemical processes, as well as excess ions. And that one's important, the excess ions, because you might have too much sodium or even increased potassium based on what you ate. The whole idea is trying to maintain that homeostatic level in your blood. And for that matter, homeostasis throughout the body. So you're trying to regulate all of these, get rid of some, balance others, all via the kidneys. But that's not the only thing we're regulating. That's just what you can get rid of. You're also regulating blood volume. Now we know, going back to the cardiovascular system, going back into those blood vessels and the blood, that the blood volume has a certain amount that you need in your body to maintain blood pressure. If you have too much, all of a sudden blood pressure increases. Not enough blood volume, the pressure drops. It's the kidney's job, in conjunction with other systems, to make sure you're helping to balance out and have the adequate amount of volume. You're also looking at chemical composition. Well, chemical composition, what's in the blood? Making sure you have the right amount of ions, right components. So the kidneys, yes, they're filtering your blood, they're getting rid of things, but they also are monitoring it to say, hey, we shouldn't get rid of as much of this ion, or let's hold on to more of that ion, trying to maintain the balance in the blood. And then you have pH. pH we know is 7.35 to 7.45 is the typical pH of your blood. That's a pretty narrow range. We know from the respiratory chapter that helps with buffering the blood. We know back in digestion there's a part there. We know back from the blood itself helps out. Well, we're also now in the urinary system helping to monitor blood pH. There's a lot of parts and pieces all coming together as far as how the body's working. And the kidneys are doing all this through their normal physiological activities. We have gluconeogenesis. Now, gluconeogenesis is when your body is in a prolonged fasting state, which means you're not really getting energy in, you're not ingesting it. So in gluconeogenesis, your body is going to take non-carbohydrate based components. Think proteins or lipids. Something that is not a carbohydrate. It'll then break those down and convert that energy into a carbohydrate form, think glucose, so your body can produce ATP. So in gluconeogenesis, we're utilizing non-carbohydrate energy forms to produce carbohydrates to use for making ATP. Another function of the kidney. Now, the kidney we've also mentioned back in the endocrine system. There is endocrine functionality as far as renin and erythropoietin. Now, for renin, we know that renin is used in the renin-angiotensin cascade. We'll get into that more later. But the basic idea here is renin activates angiotensinogen to angiotensin 1 to angiotensin 2, which then has a whole series of different functions in your body. One of the biggest ones is dealing with blood pressure. Erythropoietin, looking at red blood cell production. So that means the kidneys are having a handle and an aspect in controlling the production of red blood cells. They can actually increase your red blood cell production by stimulating more erythropoietin. And then activation of vitamin D. Now we know vitamin D came in via the intestines for absorption, and a little bit comes into the skin as well. But then you have to actually activate it for utilization. That comes down to the kidneys. All right, so let's start with a little anatomy of the kidneys. There's different connective layers and connective tissue around the kidneys. These all give different supports and different purposes. We have this renal fascia. It kind of anchors the outer layers and anchors around the outside of the kidney, helping to anchor and keep in place. You really don't want your kidneys bouncing around and moving back there. We have this perennial fat capsule. Now, this is going to be adipose tissue that's out around the kidneys. It's meant to help give a little bit of a cushioning, a little protection to the kidneys themselves. And I'll show you this in a picture in a second. And then we have the fibrous capsule. This fibrous capsule, as you can see here, is preventing the spread of infection to the kidneys. It kind of seals around the kidneys and keeps them inside. So it's creating a barrier. So 3 different layers here of supportive tissue, all meant to help the kidneys. So if we're looking here, here's the renal fascia. You'll notice that's on the outside, and then the posterior side back here as well. You then have the perennial fat capsule. You'll notice that's this yellow here. There's some more back over here. It's wrapping around it, providing a cushion. So that fat capsule full of adipose. And then the fibrous capsule itself. That's this layer that goes right around, like saran wrap, around the kidney. So that is the fibrous capsule, helping to prevent any infection from getting into the kidney from the outside tissues. Now, sure, it can still get an infection in the kidney via where the bloodstream comes in, but it's not coming from the direct tissues around it. Now, looking at the gross anatomy of the kidney, you'll notice there's 2 images here. One image is an artist's rendition. The other one is an actual photograph of a real kidney. Just gives you that comparison, because sometimes it's easier seeing things on artist's rendition compared to the real. So first off, we have the renal cortex. Cortex just means outside. So this whole area out here is the renal cortex. It goes all the way around the kidney. Now, if that's the outside, the cortex, the inside is the medulla. So everything inside is the renal medulla. So all the inside material is renal medulla. The renal pyramid, or the pyramid itself, is each one of these structures. That's one pyramid, this is another pyramid, here's a third pyramid. So those are the renal pyramids. Now, those renal pyramids we'll come back to later when we start talking about the nephron and how filtration works. So keep that in mind. At the very point of the pyramid, this is the renal papilla. So the very end of each pyramid is the renal papilla. So as it comes down, that point is going to be the renal papilla. Now, this renal papilla is going to lead into a minor calyx. So each one of these individual tubes here is a minor calyx. Now, all of those minor calyces, those individual pieces that have the pyramid coming into it. So you have the papilla into the minor calyx. Each minor calyx fuses together to make a major calyx. So for example, here's a minor calyx and here's a minor calyx. Together, they form into the major calyx. It's where they fuse and come together. Now these major calyces, so plural of calyx, go into the renal pelvis. This is the central point right here. The renal pelvis is where all the major calyces come together. Now the purpose of the minor calyx, the major calyx, the renal pyramid is transport of urine. Because the filtration throughout the nephrons and the processes there are occurring in the cortex as well as the pyramids. But then once it leaves the renal papilla, which is the point of the pyramids, is now the urine collected by the minor calyces into the major calyces, into the actual renal pelvis, and then goes out via the ureter out here. So that would be the ureter, which heads down towards the urinary bladder. So a little about the basic functionality of the kidneys, as well as some of the anatomy of the kidneys.